Hi. Welcome to ER Cocktails YouTube channel. Topic today about specific circumstances of resuscitation. Accidental hypothermia. See hypothermia. Rewarming, including extracorporeal rewarming, with standard resuscitation is not considered fatal until rewarming unless there is an obvious mortality. Anaphylaxis. See anaphylaxis. Administer standard resuscitation with an emphasis on epinephrine. Asthma. In patients with sudden increase in PIP or difficult ventilation, tension pneumothorax is suspected. Consider reducing RR and tidal volume, increased IE, to reduce the risk of auto-PEEP and barotrauma. During peri-arrest, if auto-PEEP increases or BP decreases, disconnect from bag mask or ventilator and apply chest wall compression to reduce air trapping. Cardiac surgery. In post-cardiac surgery with VT/VF, perform defibrillation 3 consecutive times. If not successful within 1 minute, then start CPR. In post-cardiac surgery with asystole or bradycardic arrest with a pacer wire, perform pacing. If unsuccessful within 1 minute, initiate CPR. Consider resternotomy for post-cardiac surgery within 10 days. Open chest CPR during or shortly after surgery. In cases that do not respond to standard treatment, ECMO or cardiopulmonary bypass may be performed. Drowning. Perform CPR with rescue breathing by resuscitation as soon as possible. Mouth-to-mouth ventilation may be performed in the water. And all who received resuscitation, refer to hospital for observation for at least 4 to 6 hours. Routine cervical spine stabilization is not recommended. Electrolyte abnormality. Hyperkalemia. IV calcium. 10% CaCl25 minus 10 milliliters or 10% Ca gluconate 15 to 30 milliliters IV over 2 to 5 minutes. Sodium bicarbonate 50 MEq IV over 5 minutes. Mixed 50 grams glucose plus Ri10 IU IV over 15. Minus 30 minutes. Nebulized albuterol 10 to 20 milligrams over 15 minutes. Emergent hemodialysis. Kexalate is not recommended. Hypomagnesemia. MgSO41-2 grams plus 5 DW 50 to 100 milliliters Sig IV over 15 minutes cardiac arrest plus QT prolongation. Hypermagnesemia. IV calcium. Hypokalemia. KCLIV 2 MEq, min then 10 MEq over 5 to 10 minutes, life-threatening hypokalemia. Opioid overdose. Naloxone 0.4 to 2 milligrams IVQ 2 to 3 minutes. Pregnancy. See pregnancy resuscitation. Pulmonary embolism. In diagnosed cases, thrombolysis, alteplase 100 mg IV bolus or IV over 15 minutes or 50 mg IV bolus. Then 50 mg IV over 2H, or surgical embolectomy or mechanical embolectomy. In suspected PE cardiac arrest, thrombolysis is considered. BZD overdose. Flamazanil is not recommended in undifferentiated coma. Beta-adrenergic blocker overdose. Refractory shock high-dose insulin. Rhode Island 1 U per kilogram IV bolus, then 1 U kilogram per hour plus 50% glucose 50 to 100 milliliters, then drip 0.5 grams kilogram per hour. Monitor. Glucose Q 15 to 30 minutes. Hemodynamic response 30 to 60 glucagon 5 milligrams IV over 1 minute, 10 to 15. Then drip 2 to 5 milligrams per hour. Keep MAP greater than 60 millimeters of mercury or consider giving calcium or doing ECMO. CCB overdose. Refractory shock 10% calcium gluconate 30 to 60 milliliters IV over 10 minutes. Repeat Q 20 minutes up to 4 times high-dose insulin. 1 U per kilogram bolus, then 1 U kilogram per hour. Plus glucose or consider giving IV glucagon or doing ECMO. Cocaine-induced HT. Agitation, chest discomfort. BZD. Alpha blocker. CCB. NTG. Morphine avoid beta-adrenergic blocker. Local anesthetic. Neurotoxicity cardiac arrest bupivacaine toxicity lipid emulsion 1.5 milliliters per kilogram IV. Max 100 milligrams, over 2 to 3 minutes, repeat as need. Then drip 0.25 milliliters per kilogram, min. Sodium channel blocker, TCA. Sodium bicarbonate 1 to 2 MEq per kilogram IV over 1 to 2 minutes cardiac arrest or cardiac conduction. Delay. QRS greater than 120 milliseconds. Repeat until stable, narrow QRS. Then sodium bicarbonate 150 MEq plus 5dW1L drip rate 150 milliliters per hour. Keep serum pH 7.45 to 7.55 or consider ECMO. Digoxin toxicity. Antidigoxin Fab severe cardiac glycoside toxicity. CO poisoning. Hyperbaric oxygen therapy severe toxicity. Cyanide. Hydroxocobalamin 5 grams IV over 15 minutes. Repeat 5 grams IV over 15 minutes 2H, plus 100% oxygen plus or minus sodium thiosulfate 12.5 grams IV. Repeat half. Thank you for watching. Please subscribe for new video.